Broca's area. Broca's area is actually a main part which is used for recognizing one of the main is been recognized as one of the main language centers of the brain. This region is associated with the production of speech and written language, as well as being linked with the processing and comprehension of language. Specifically, this area is considered to be the part of region called inferior frontal gyrus, a gyrus being a ridge on the surface of the brain's cortex. Typically, Broca's area is located within the dominant hemisphere of frontal lobes, which is left hemisphere, is around 90 in the around 97% of the people. In general, left hemisphere of the brain is responsible for the language speech. Broca's area. In this slide, we could see the Broca's area and Wernicke's area. Broca's area, which is responsible for production of speech, and Wernicke's area, which is responsible for understanding the speech or languages. Damage to Broca's area may cause many conditions that may result in persons inability to produce the speech. There are many conditions that may result in damage to Broca's area, including stroke, traumatic brain injury, tumors, and brain infunctions. Most common symptom of brain damage to the Broca's area is expressive or non-fluent aphasia. While there are many types of aphasia, expressive aphasia is a particular is caused by damage to Broca's area, hence it also known as Broca's aphasia. Broca's aphasia's symptoms include poor or absent grammar, difficulty forming complete sentences, omitting words such as the, and is. A person with Broca's aphasia may say something like cup me instead of the I want the cup. Most difficulty using verbs than nouns correctly. Difficulty articulating sounds and words. Difficulty in repeating what has been said by others. Trouble with writing sentences. Difficulty reading. Problems with full comprehension. Difficulty following direction. Frustrations are the symptoms of procrastination. So, diagnosing and treating Broca's aphasia requires an MRI or CT scan. These tests help determine the exact area of the brain that is affected as well as the extent of the damage. Broca's aphasia requires treatment with speech therapy. Speech therapy involves working with a speech language pathologist, both in person or online, can greatly enhance progress. The more practice someone has speaking in a safe environment, the more likely they may be to continue trying to improve. So next is the orbitofrontal cortex, OFC, the part of the prefrontal cortex of the frontal lobe. The orbitofrontal cortex is closely related to the olfactory bulb and tract. Orbitofrontal cortex is an important region of the brain involved in the processing of rewards and punishments. It receives and integrates inputs from all the sensory modalities like taste, smell, somatosensory, auditory, and visual, as well as the visceral, sensory, and meserical motor information. It also involves functions like social adjustment, mood, and drive and responsibility. So about the orbitofrontal cortex dysfunction, the orbitofrontal cortex is involved in emotional processing and orbitofrontal abnormalities have often been observed in various affective disorders, which is the mood disorders. Thus, chronic dysfunctions of orbitofrontal cortex may cause symptoms of mood disorders such as anxiety, depression, and impulsivity. Orbitofrontal cortex and personality. Damage to the orbitofrontal cortex can cause personality changes. The connection between frontal lobe damage and personality change was discovered with the case of penis gland. So about the case of penis gate, in the mid-1800s, the case of penis gate led scientists to discover that orbitofrontal cortex damage can also cause personality changes. The gate was a railroad worker who was using a tamping iron to pack explosives to a drill hole when the powder accidentally detonated. During the explosion, an iron bar shot through the gate's left cheek, penetrated his orbitofrontal cortex, and excited through the top of his skull. Although he survived the injury, he quit became known as no longer gay due to personality change and that was caused by damage to orbitofrontal cortex. Orbitofrontal cortex damage can cause behavioral changes like poor decision making, decreased emotional responses, personality changes, other behavioral changes like childlike behavior or aggressive behavior, apathy or low motivation, flat affect, lack of empathy, and or concern of others. Management techniques for orbitofrontal cortex damage is cognitive behavioral therapy, that is CBT, social skills training, mindfulness meditation, medication may not help treat orbitofrontal cortex damage directly, but it can help treat other possible symptoms from a frontal lobe injury such as pain or anxiety, attention deficit hyperactivity disorder. Drugs such as methylphenidate may also help reduce impulsive behavior. Reducing the help might also help in reducing the impulsive behavior. Thank you so much.